Hi, I'm Michael. This is Sanaa. This is Alex. That's Megha. And this is our opioid presentation from Skyline High School, Washington.
Hello, today we'll take a look at the opioid crisis we are currently facing. Through a short skit following events in a teenage boy's life, we will demonstrate the effects opioids have on the body and ways that our communities can help prevent this.
Congratulations, your wisdom tooth surgery went great. You will be experiencing some pain for the next couple days, but it should be able to be controlled with moderate painkillers. If it gets much worse, then fill this prescription for opioids. Let me know if you have any questions.
Hey Mom, the pain is really starting to kick in.
No worries, sweetie. I got your prescription filled in just in case you need it.
Many people think of disease outbreaks like coronaviruses as the only type of public health emergencies, but the truth is that a public health emergency can be anything that causes a widespread health concern. In 2013, opioid deaths started spiking rapidly until 2017, when President Trump declared the opioid crisis a public health emergency.
Opioid addiction typically follows the pattern of 1. Intense intoxication, 2. Increased intolerance, 3. Escalation in use, and 4. Withdrawal symptoms, such as nausea and depression.
One problem with opioids is that doctors will prescribe them for chronic conditions, not moderately like they should. Prescribing opioids for extremely painful acute conditions is much more reasonable and may reduce the risk of addiction. However, this does not stop opioids from possibly being abused.
It's fine, my teeth are healed and I don't need them anymore. But if there's a label for a refill, I can maybe use them, just in case. See, there's no label for a refill. I don't need them. But I feel like I need them. Even though my teeth are healed, I just genuinely felt better when I was taking them. I was happier, I focused better at school, and I didn't feel any of my normal anxiety. I think I know a friend who can help me get some pills. I mean, the pills will be the same as the doctors, and those only help. Hey, Sanaa.
Yeah, what's up?
You know a dealer, right? Can you help me get some pills?
Yeah, totally.
And they're safe, right?
I've been using them for about a year now, and I'm totally safe. I'll hook you up in about an hour or so.
Thanks so much.
Dopamine is a hormone that gives people the feeling of pleasure and is necessary for human life and happiness. Many drugs will trick brain cells into producing dopamine, giving the user a pleasure high while the drugs are in their system. If the user stops taking the drug, the flush of dopamine will stop, making the user more prone to anxiety and depression. Withdrawal may also cause the user to experience physical symptoms, causing them to take the drug again, creating a cycle that is hard to get out of.
Plus, like other drugs and addictive substances, the effects of opioids on each individual's body will vary greatly. Just because one friend is able to stay in control and only use opioids occasionally doesn't mean you will be able to.
Michael, would you like to explain to me why you're failing classes before I get angry?
Whatever, it doesn't matter.
Doesn't matter. That is your life you're throwing away. I don't even know who you are anymore. You quit skiing, which you love. You're talking back to me, and now you're failing school? What is going on?
Maybe I should tell her about the pills. Maybe she could help. I mean, the pills helped at the beginning, but now I'm just feeling the need to take more and more, and I can't even focus. Wait, what am I saying? She'll make me stop completely. I can handle this myself. Leave me alone, alright?
Hey Michael, where were you this weekend? You totally flaked on my game, bro.
I forgot. Sorry.
Are you okay? You've been acting kind of different lately.
I'm fine, alright?
I really think I should get him some help, but I thought they would work the way they did on me. Plus, I should be a good friend and stay loyal to him because I don't want him to get into trouble. These are common signs of opioid addiction. Opioid addicts may become sweaty and nauseous, have difficulty breathing, and may experience frequent mood swings. If you see a person exhibiting these signs or symptoms, immediately tell a trusted adult. It may be hard at first, but it could save your friend's life. Is that a good idea? We should go dance or something.
Chill out, okay? It's a party. I'm not driving, I'm sleeping over.
I really think I should get him some help. But I know he had a tough week with finals, and he did say he was sleeping over, so I think he should be fine. Besides, if I call the cops, we might all get into trouble, and I certainly wouldn't want that. Media reports and official alerts in several U.S. communities are warning against street-bought counterfeit opioids that are incorrectly laced with fentanyl, an extremely potent narcotic that is 100 times more powerful than the normal opioid. These are responsible for the growing number of opioid overdoses because, as you can see, it is nearly impossible to tell the fake pill from the real one.
Oh my god, Michael! His lips are turning blue, and he has no pulse. Quick, someone call 911. Does anyone know CPR?
When someone overdoses, you'll often see a depressed level of consciousness, respiratory depression, cold and clammy skin, cyanosis, and markedly constricted pupils. If you see a person exhibiting these signs and symptoms, call 911 immediately and wait with them until first responders arrive. If they are unconscious, make sure to put them on their side so that if they vomit, they will not choke. If they are conscious, make sure that they do not eat anything. When first responders arrive, let them know what substances were taken if you know. Do not worry about being caught if you are at a party. Most states recognize Good Samaritan laws that protect you from being arrested for illegal drug use when helping in an emergency incident. If you have access to Narcan naloxone nasal spray, which looks like this, use it immediately. This could potentially reverse the effects of an otherwise fatal overdose by binding to opioid receptors in place of the drug itself. Never let someone fall asleep when possibly overdosing. Ma'am, I was the doctor on call in the ER when your son came in last night. We believe he suffered an opioid overdose due to fentanyl-laced Streetball pills. We attempted resuscitation, and we even tried to administer naloxone, but it was just too late and the damage was done. Despite our best efforts, I'm so sorry, but your son passed away.
My poor son. Maybe if I'd known about his drug addiction, he would still be here with me today.
We understand that every situation is different, but we wanted to act this scene up for you to emphasize that drug addiction can happen to anyone, even people who have not been exposed to gateway drugs such as marijuana. Even though in this skit, opioid addiction stemmed from prescription drugs, it can also start from anxiety, depression, peer pressure, and recreational use. We as a community need to shift our attitudes from alienating drug users to helping them widen access to prevention, treatment, and recovery services.
In our high school community at Skyline, death from opioid overdose is not just a threat but our reality. Just 6 weeks apart from each other last August and September, we lost 2 members of our junior class to fentanyl-laced opioids. Both Tom Beatty and Lucas Barrer were just 16 years old when they were taken from their family, friends, and loved ones. We spoke to both families before giving this presentation, and Lucas's mom, Olga Barrer, has something she would like to say. She wants to warn you against trying opioids even once, because they do make you feel good for a while, and that's enough to keep you hooked when things go bad. She says that no matter what factors are pushing you towards it, whether it's peer pressure or depression, is not worth it, and to reach out to a trusted friend instead.
We think every high school and middle school in this country should have mandatory drug safety awareness talks, since at some schools, like Skyline, health is not a required class for all students. More importantly, the talk should not just be don't do drugs. They should actually strive to limit the impacts of opioids in the community by warning about the dangers of counterfeit street pills, how to recognize addiction, what to do in case of an overdose, and offer information about local help centers. At Skyline, we only got drug education after the deaths of both Tom and Lucas. It is impossible to say, but maybe if we had them earlier, they would still be with us today.
Everyone has a role to play in changing the conversation around drug addiction. Remember, you are not being a snitch, you are not being uncool, and you may be hated for a while, but hey, that's the price you're going to have to pay for saving someone's life. If you need help quitting, please reach out to trusted adults and drug state help centers. They are here to help you. Your life is valuable, and it is up to you to decide what choices you make.
In honor of both Tom and Lucas, we hope their story makes you think twice about drug use. It is time to stop opioids before they stop you.